The increasing costs of healthcare in the United States have become a great burden to the average American. Costs are falling on the patient more now than ever before. This is due to employers cutting benefits and public health care assistance programs slashing reimbursement. Approximately 47 million U.S. residents do not have health care insurance. The proverbial cash cow of the United States healthcare system and the crashing economy has resulted in many company cutbacks. The easiest of these is employee health benefits. The increase in insurance deductibles and copays are causing Americans to delay or deny treatment. A worker making less than $20,000 a year would have to pay close to $5,000 a year to maintain the same level of health insurance benefits he would normally receive from his employer. The average household spends $2,350 a year, or 4.8% of its income, on health care. The evidence has shown that the health care cost increases are offset by either direct wage reductions, increased employee cost sharing, or in instances where wages are fixed, increases in the number of hours worked. This may result in layoffs, decrease in labor force, and the increase in number of temporary workers. Outsourcing has been another avenue companies have chosen to cut costs. Let's look at why.
Here we show a figure showing the annual small business profits lost due to healthcare costs. It starts in the year 2009 and is projected to the year 2018. As of right now, healthcare costs are estimated at $1 billion. It is supposed to reach all the way up to $12 billion in the year 2018.
Some companies are cutting coverage on routine eye exams and physicals, while others are offering more benefits for regular exams in hopes to diminish large claims in the future. State employees in North Carolina, for example, are required to quit smoking or lose weight if they are considered overweight to keep their low-cost health insurance benefits. If employees choose not to change their lifestyle, they will be obligated to pay an additional 30% of the doctor bill on top of their regular copay. In 2003, roughly 43 million people reported financial problems paying medical bills. Obviously, this impacts the average middle-class American a great deal. More Americans live with ailments that they cannot afford to get treatment for. The bottom line, employees need to get educated about their health and make smarter choices about their insurance benefits.
What about those who are no longer working? What happens if they get sick? About 40 million older Americans participate in the government Medicare and Medicaid programs. This program benefits seniors that are 65 years of age or older. This program will pay for skilled nursing, a limited amount of home care, hospice, and transportation services. However, the program is cutting back too. Recently, the program has announced that they are cutting funding for hospital readmissions. If the patient has been admitted to the hospital in the past 30 days, the hospital will no longer get paid for the patient's stay. This means that hospitals will try to discharge the patient as soon as possible. Historically, the hasty release has resulted in poor discharge planning. Many times, patients and families are forced with many tough decisions if the patient requires additional care after the hospital stay. In order for a patient to qualify for Medicare to pay for skilled nursing services, they must be 65 years of age or older and have a recent hospital stay for 3 midnights. This leaves some patients in a financial crisis if they do not meet the Medicare requirement. These patients have to pay out of their pocket for services that would have been covered by Medicare. The amount can go as high as $8,000 a month. With many seniors living only on mediocre pensions, Social Security, and little or no nest egg, they cannot afford for health care they need. In response to this program, the government has implemented the Medicaid program. This program provides assistance to both seniors and working citizens who are at the poverty level. Unfortunately, to qualify for this program, seniors have to liquidate and spend down their funds to $2,000, and the average citizen has to pay nearly destitute. After the patient has met all the requirements for the Medicaid program, they will need to pay for all health care expenses required by the patient.
In conclusion, even though the government offers many health care programs, they only provide assistance for the elderly and the poor, with minimal assistance to the middle class. The government should make more programs available to the average working class citizen.